I drove a Cadillac. He had it all. They say he was.
Hello, hello, hello. Welcome again into 1017 FM and 710 KEEL. Welcome into this edition of Strategies for a Living. I'm marriage and family therapist David McMillan. Look at there, smiling like a Chessy cat down there at the other end of the broadcast table.
Tomorrow's Friday.
Yeah,
Woohoo!
you're happy. PLPC Carla McCormick. How you doing, Carla?
I'm doing good. I had a really good day today.
I'm glad. You look like you had a good day.
It's fun when you have a good day.
Absolutely. We may want to hear more about that, but not right now because
Okay.
we've got work to do, and we'll bring on our ace of the airwaves. He's the guy that keeps this thing flying. Rapid Ruben Wright.
Good evening, everybody.
How you doing?
I'm doing great. I had a pretty good day, too. Any day where I get a nap is a good day.
I would say that's a good day. I'm envious. You know, Carla, since we started the show back daily in February, how many times have we said we have in Shreveport, Bossier City, in this area, we have some of the best mental health professionals, and we've said that over and over.
Because it's true.
It is true, and we're going to show it to be true this evening because we have two of the brightest and the best today. Dr. Bruce McCormick, Dr. Webb Centel. We are going to talk. You know, there's a lot of different places that you go for mental health help, but it gets confusing, you know, between an MD, psychiatrist, a counselor, a marriage and family therapist, a licensed addiction counselor, a licensed clinical social worker. And then there's this new animal. They're called MPs. Now, they're not military police, but they may be just as important as military police. They're medical psychologists. We're going to learn all about that and more from Dr. Bruce McCormick and Dr. Webb Centel. Folks, thank you for tuning into Strategies for Living. We are presented by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana. Been helping individuals and families for 60 years. We're also brought to you by Milestones Counseling Center, by Jerry Anderson State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Jacob's Well Inspirational Books and Gifts, and by Resilient House. We will be back to meet our life strategist, Dr. Bruce McCormick, Dr. Webb Centel, here on Strategies. Stay with us.
Sounds of the city pounding in my
back. Welcome back into 1017 FM and 710 KEEL. Welcome back into Strategies for Living. Marriage and family therapist David McMillan, PLPC, Carla McCormick. Yeah, I remember your name now. Please welcome to the program our life strategist this evening. Dr. Bruce McCormick is a native of Shreveport. He's been in private practice in mental health for 40 years. He's been practicing psychology for 30 years, and he's the first chair of the Psychology Regulatory Board for Prescribing Psychologists. Dr. McCormick, welcome to Strategies.
Well, thank you, David. It's good to be here.
It's good to have you here, and thank you for. I know it's a busy time for you, so thanks for coming, and we're going to have you back again and again if you'll come. Also, welcome Dr. Webb Sintel. He's been practicing psychology since 1995. He was part of the early movement for prescription privileges for psychologists. He is actually the first civilian to be regularly credentialed to prescribe as a psychologist in the United States Air Force.
That's correct.
Dr. Webb Sintel.
Thank you, Dave. It's good to be back.
Thank you, sir. You've been here a few times, in years past, and people may or may not remember that
I hope they forgot.
We were class of 1974 from Jesuit High School.
Definitely forget that.
So I've got some stories that if if you don't pass some bucks under the table, will come out before Bruce will learn of them before this show ends.
You probably know more of them than I remember.
I understand. Okay, so we have, gentlemen, many times talked about how many wonderful mental health professionals we have in this community. We have something unique. Louisiana doesn't lead the nation too often. But in what you guys are doing, I'm proud to say Louisiana, and in no small part, thanks to you two gentlemen, are leading the nation. You are part of medical psychologist, which is basically you go and you get a lot more education beyond your doctorate, and you learn how to prescribe medication. You're an MP, and you guys have even gone beyond that. You're MPAPs. That's
correct.
Medical Psychologist Advanced Practice. Dr. Bruce, how did this come about? How did this all start?
Well, it really dates back to the late 1980s, early 1990s, when there was a growing recognition that counseling, psychotherapy, very important part of mental health, was taking care of one part of our public's needs, but also the medical, the pharmacology, the chemical part was another aspect that was very important, but there was not as much of an integration of those two treatment modalities and treatment models as perhaps would be optimal.
Yes.
So for about 10 years, we struggled with how could we make this happen, and finally, in 1997, the first class ever for a brand new degree, clinical psychopharmacology for doctoral level licensed practicing psychologists came into being, and Dr. Sintel and I were in that first class.
Wow, that's amazing. Now, did you know right away, Dr. Webb, that you wanted to jump into this?
David, I knew when I was at Vanderbilt. I heard on my internship there's a group of crazy psychologists. At Vanderbilt, they had you pull call with psychiatry, and you had the MOD, the medical officer of the day, write your scripts for you. And so it was, I'd already kind of gotten interested in that a little bit. And I heard that there was this bunch of folks in Louisiana that were trying to do this. And I called Dr. Jim Quillen before I left Nashville. And I said, I want to be part of it. Of course, he didn't even write my name down then, but we were significantly involved.
Wow. Now, there aren't many states in the nation. I may be asking you something that you don't know. I apologize if I'm doing that, but we're one of how many?
Well, currently psychologists prescribe in only 5 states: Iowa, Idaho, Illinois, New Mexico, and Louisiana. And I'm going to tell you that we are by far and away the most involved.
Wow.
And there's a whole history for that. I don't know what you want to get into, but it's been disappointing to me that more states haven't followed suit with Louisiana. We tried to tell them how to do it and
show them the way.
I would like to take the chance to point out that the very first prescription ever written by a civilian trained psychologist in the country, at least, was in Louisiana, and by Dr. John Bolter in Baton Rouge. So
Wow.
we were groundbreakers in that regard.
You know, and you guys probably won't say this, but I will. You know, there is such a need. You know, if I have a client or Carla has a client that comes in, and we need to make a referral to a psychiatrist, not picking on anybody, but pick up the phone and give a call, and you'll hear, well, yeah, it's July the 12th. We have Dr. Jones has an appointment available for you. His first available appointment is August the 30th. You know, and that's not uncommon. So this specialty area that you two guys have are absolutely pioneers for is so we're so thankful to you. We're so grateful. And Dr. McCormick, Dr. Centel, I personally have called both of your offices, and I can guarantee people listening that the wait is not anywhere near that. Don't know how you do it.
Well, we try to hustle.
But you do it.
We try to hustle.
Yeah.
Of course, it was a long, drawn-out process to get the education in the program and then get the legislation passed. And then
Yes.
there was some question as to whether the governor would sign or veto. There's a lot of input on both sides of that.
Who was governor that signed?
Kathleen Blanco was the governor.
Wow.
And one of the advocates, not a medical psychologist, but a psychologist who was an advocate, was talking to Dr. Blanco and said, have your staff call and see how long it takes to see someone who can prescribe, and consider that. And I think that wait that you were talking about was no small part of one of the reasons that this made it where it is.
You grew up in Shreveport, Dr. Bruce. How early did you know? When did you know that I'm going to practice psychology here?
I can tell you exactly the day. It was my sophomore year in a personality psychology class, and I was listening to my professor. I was at what was then NLU's, now ULM. And I said, I'm not exactly sure what that guy does, but that's what I want to do when I grow up.
I love it.
You know, except for a period of military service, I've either been studying or doing it ever since.
Dr. Webb, I remember when we were running around Jordan Street, and I remember you from those days, and what a thoughtful guy you were.
Well,
Heck of a shortstop,
well,
too.
thank you, David. Thank you.
State championship team, 1974, Dr. Bruce. Part of it, part of
understand
one of the.
that, yeah.
I mean, I bet he still got the ring.
Thank you for remembering, David.
Oh
That's
God!
good.
What a trip that was!
Oh,
What a
wow.
man! What a year that was! You made our senior year worthwhile.
Wow.
You know, you and those other guys,
Yeah.
and Champ, Coach Champ Cicero.
Absolutely.
Yeah.
Absolutely.
When did you know?
David, my swim coach in Minden, Coach Sonny Taylor, told us in a pep talk, he said, be like Centel and psych out your opponents. And I went to him, I said, Coach, what is psych out? And he told me about psychology, and I went home, and I said to my sister-in-law, who was living with us, I said, I think I want to be a psychologist when I grow up. And she said, don't you mean psychiatrist? I said, well, what's the difference? She said, well, a psychiatrist can prescribe medication that psychologists can't. And everything else about psychology I really favored and preferred. I loved the feel and the discipline, but it was just so interesting and amazing that I got a chance to correct the one thing about psychology that I thought was missing in about the 6th grade, I think.
Wow. You know, I will ask both of you, do you ever have a dull day?
I hope to some days.
What is that?
Yeah. Well, you know, what we do, I mean, it's amazing. It's amazing to be able to be with people in the ups and the downs. I admire that the two of you. I mean, the talk about a little bit, guys. About, I mean, you know, we made the introductions. We said you had to go to class, but this was no small deal. I mean, I remember when you were going through it. I think I was teaching adjunct to class at Tech.
Right.
And you came to speak to us. I don't remember by saying, you said, Dave, let me tell you what I'm doing. And you said, my buddy, Dr. Bruce McCormick, and you mentioned a few other names. We're all going down to Baton Rouge, and I couldn't believe how many times you were traipsing back and forth.
Bruce was a great buddy. We big roommates for a lot of years, and we've been through a lot, and it was really exciting. And it's kind of like going through boot camp together.
How was it different? What was different about this? What was the most different thing as opposed to your doctoral education, Dr. Bruce?
I think certainly for me, and Webb, you can agree or not, but I think it was a combination of being very exciting and rather intimidating.
Yeah.
Because we had not planned to have medical training, and it wasn't just pills. They were neuroscience and
you got
and
into
basics
the brain
of clinical medicine
yeah.
and things like that.
You got into the brain,
and I didn't take all those courses in college, so we had to do some catch up.
Yeah.
So that, and then just the intensity of the study,
Yeah.
because it was a lot of hours on a lot of weekends.
We're talking this evening with Dr. Bruce McCormick, Dr. Webb Centel. We're talking about medical psychology and medical psychologist here in the Shreveport-Bossier area. Here on Strategies for a Living, we'll come back and learn much more from these gentlemen. Stay with us.
With the sun down, shining in. I found my
Sometimes I wish you could hear what goes on during the breaks. But we just can't do that. Welcome back. Welcome back into 101.7 FM and 710 KEEL. Welcome back into this edition of Strategies for Living. PLPC Carla McCormick, marriage and family therapist David McMillan, our life strategist this evening, pioneers as medical psychologists, Dr. Bruce McCormick, Dr. Webb Sintel. Now, you guys both, for years, practiced as psychologists. Now you're practicing as psychologist and medical psychologist. Dr. Bruce, what's a typical day like for you now?
Well, I think the thing that perhaps makes it a little different than it might have otherwise been or might have been originally, we still very much do psychological assessment, counseling, psychotherapy, not unlike a licensed marriage and family therapist, a counselor, or a clinical psychologist might do, or as you mentioned, some of the other professions. But our treatment model involves an integration of pharmacology, that is medication, sometimes. Right. Sometimes we mostly do medications, much like a psychiatrist might do. Sometimes we do mostly psychotherapy. But if there is a chance for both of those modalities to be integrated and coordinated,
it gives the opportunity to do that.
It does, and I think that's always in our mind, whether we choose to do it. And one of the things we pointed out was the ability to write prescriptions legally also gives you the ability to discontinue medicines that someone else might be taking, because you can't say don't take that medicine if you don't have prescriptive authority.
Right. How about a typical day for you?
Well, Dave, I do. Coming in the morning, a lot of times we have a Louisiana vocational rehabilitation client there to do an assessment, try to help them get back into the workforce.
Right.
That's really quite meaningful to me. I've been very fond of Louisiana Voc Rehab and hope they
You've
continue
done a lot
to
of
get
that
a lot
work.
of they need funding too. We do disability evaluations for Social Security, so I feel a lot of sense of responsibility
Again,
to be involved with that.
important work.
And I do a lot of prescribing. I do a lot of medication management. I still, today I had a very interesting family therapy session. In fact, I had two very interesting family therapy sessions. One was actually a couple session. So I do a bit of therapy. The pressure's on me to prescribe because we have some other counselors there that do a good bit of the therapy. So, but I keep my hand in it all, and it's and the other thing we've started doing is Medicaid clinics. That is a very challenging and a wonderful thing to be able to help this completely very underserved population. Medicaid has a lot of problems in Louisiana that we need to fix, that prevent people from getting their medicine in a timely fashion, in a regular fashion. So there's a lot of work to be done there, but Bruce and I both have very much enjoyed serving the underprivileged portion of our community.
Thank goodness that you step in, because, again, there may not be enough psychiatrists in town to cover all of those clinics if you guys weren't here.
That's right.
What as you have gone through this, how is it, what's different between what you imagined it was going to be and what actually is? What are the big differences?
I'll jump right into that because I was thinking about that. You know, I used to be not disrespectful. There's a lot of great psychiatrists in the world.
Yes, there are.
But, you know, I used to say, boy, they prescribe a lot of medications. What are they doing with this polypharmacy stuff? Yeah. And I try to be very parsimonious and start low and go slow and be conservative. But I look up and I go, my goodness, I've got this person on quite a few medicines here, and now I understand that you know how it happens, and you try to be rational. They call it rational prescribing, but sometimes you end up with more medicines than you initially thought you would be using. But a lot of times we can keep the number and the complexity down. But I have to give it to some of my psychiatric colleagues that sometimes polypharmacy just evolves in a patient.
Yeah. Now, I would imagine there are places that are very, very happy you guys are available to them. Maybe the VA Med Center?
Well, actually, I left the VA to come to Barksdale Air Force Base, where they were going to credential me to prescribe and give me the opportunity to really be a first in that particular area. The VA to this day, David, does not credential medical psychologists. We could have them in all 50 states in the VA system, because if you have a license in any state, you're qualified to practice in a VA.
Wow.
So that is a huge missing ingredient to the veterans of our country getting the psychiatric medicines they need. They're always talking about we don't have enough psychiatric providers, and yet they refuse to credential medical psychologists.
What is that about?
Well, I think it's worth mentioning that we have civilian trained. Matter of fact, one of our classmates has since been a medical psychologist in the military, even came under fire in Iraq and served on an aircraft carrier. So, Dr. Centel has prescribed for persons, men and women in uniform. Our colleague has prescribed for persons, including in combat. But for some reason, we can't do it at the VA. And what that is and interesting, the VA already hires people who have this credential and do not allow them to use it. It's not like they would even have to have them trained more. This is, without belaboring the point, this is a vestige of the old political battle about whether this should happen at all. And the VA is still on the backside of progress with this. It is not a medical, it's not a safety issue. It's a costly oversight, but it's a vestige of the politics.
I'm going to ask you a question, Dr. Bruce, because you were the first chair of the Psychology Regulatory Board for prescribing. I'll understand if you choose to not answer this, but I hope you will. What was the biggest hurdle? Who put the biggest hurdles in front of you? Not you personally, but psychologists seeking this privilege that has obviously needed. Where were the biggest hurdles?
There's a long history of medicine being skeptical about others performing medical services. There was a time when, many years ago, when physicians didn't think nurses should use stethoscopes because it was medical equipment. And you see that type of thing still.
Right.
And, of course, their interest is maybe somewhat turf, but it's also public safety. So the medical community initially, after that, because we work very well with medical specialties and with primary care particularly, I think psychiatry may have been a little more hesitant to embrace what we're doing here, although even that is
that's changing.
Is changing very much. Yes.
Mm-hmm. Yeah. But what for you? I mean, you were big also in pushing this through. Yes. What were the biggest hurdles that you experienced?
Those kind of exactly what Dr. McCormick said. The people saying that people would be killed, that people would be endangered.
Right.
And we've had a great safety record here in Louisiana. We've been practicing for years and years and years now. And you just proceed cautiously. I tell people, I said, I don't want to give your child a medical problem trying to help with a behavioral problem.
Right.
So we're very cautious, but you wouldn't believe the kind of horror stories that people told, and it was very interesting to watch this bill go through. And
how long did it take to move the bill from actually someone stepping up and sponsoring it and introducing it to the governor's signature?
Well, we took our first class in 1997, and the bill passed in 2004, and the first person actually came online to prescribe in 2005. So what's that? 8 years? Not counting the 5 or 6 years it took some university to have the fortitude to offer the course, because there was a lot of pressure on universities not to teach.
Right.
Not to teach this class.
Right. And actually, we were chatting a bit. You guys, I said, ignorantly, oh, you guys went to LSU, but you didn't.
No, LSU got too much pressure.
Yeah.
And so did Xavier. They got a lot of
pressure. So your degree was actually from a California university.
It was originally California CSPP, California School of Professional Psychology. They are now Alliant College, and they renamed themselves, and they have been quite courageous in helping train medical psychologists all over the country. I think there are a lot of people that are trained and ready to go, but Louisiana is the only place that you can really practice.
Right.
I think it's noteworthy that, and Dr. Centel's right, California School of Professional Psychology was the institution that sponsored and granted our degree. But our faculty were, by and large, LSU Medical School faculty, ULM Pharmacy School faculty, Tulane Medical School faculty. They just moonlighted for the
Right.
California University because the politics in Louisiana were such that it was a little dangerous for universities to take that step.
You mentioned children just a moment ago. What's the age range of medical psychology? What you treat from where to where?
Well, from the beginning to the end. I don't do a lot of extremely elderly people, but
Right.
I do. I'm a neuropsychologist as well, so I do.
Now, what does that mean? How does neuropsychology?
You can summarize it, David, by saying it's brain-behavior relationships.
Okay.
We look at how the brain is functioning rather than do a CAT scan or an MRI. We do a neuropsychological assessment and see how your memory is functioning or how your attention is compared to other people. We can actually measure attention quite well, much better than we can measure mood swings, for example.
Right, right. So if if I'm, for instance, concerned, my child has an attention issue, we can't quite put our hands on it, wrap our hands around it. That may be a place. If I'm concerned, mom or dad is just not functioning as they used to.
Memory problems.
Memory problem. That would
Yes.
be the place for
Yes,
neuropsychology.
Yes, and psychologists tend to approach it as a statistical type of diagnosis. When things are 2 standard deviations away from normal, we say you need some help.
Right.
Whether it's ADHD or Alzheimer's or whatever.
How important is when someone comes in to see you? What's in your minds in terms of I gotta make sure I do this. What goes through your minds about connecting with your client?
I think one of the things that perhaps is unique to psychology and by extension to medical psychology is a lot of our training as psychologists is how the environment one lives in and one was raised in affects what's going on now. Not everything that we see or that we may be concerned about is biologically based.
Right.
It may have a lot to do with what has and hasn't worked or what we've had to do to survive an environment, and yet those things can affect our biology.
Yes.
If we have an easy or a difficult time in some way, that affects our brain chemistry as well. So probably more of a reliance on history and current environment as it relates to whatever an individual may need, whether medication is part of it or not.
How important is it? I'll traipse down this area. How important is it? Let's just say hypothetically that my child, it's obvious that there's a problem with attention, and but I take the position of I'm going to wait and see. I'm going to wait and see. Am I harming that child?
That's a tough call, Dave.
Yeah, I know.
And I've got a lot of sympathy for people who do wait, and they go, and there's very few natural things that have strong data, but it's if the child is failing socially, academically, in a lot of areas, you probably need to go get a consult.
Right. That I was kind of brought that from the environmental.
I think there's perhaps something of a critical period. It's right toward the end of 2nd grade, beginning of 3rd grade, when children start realizing, hey, this is not working for me as well as my classmates. And the danger there, I believe, is when the child starts giving up on herself or himself, then the things that might otherwise work are that much harder to implement. So not rushing to judgment, not rushing to medicine, but also not letting that sense of self-efficacy.
A delicate balance, then.
Precisely.
A delicate balance. We are talking with Dr. Bruce McCormick, Dr. Webb Sintel. We're talking about medical psychologists. Both these gentlemen are MPAPs. We've got more to learn. Stay with us. More strategies for living coming back. Welcome back. Welcome back into 101.7 FM and 710 KEEL. Welcome back to Strategies for Living. I'm marriage and family therapist David McMillan. You've been quiet down there. PLPC Carla McCormick. You're learning today, aren't you?
I am. I'm soaking it in. I'm kind of a little bit in awe. I'm a little awestruck.
I can understand why you're sitting next to Dr. McCormick. I've been awestruck a bit by him, too. This other guy, we'll talk differently, but Dr. McCormick, different deal.
I do have a question before you get going, wherever direction you're going is, for a layperson, what is the difference between an MD psychiatrist and you guys as medical psychologists? How would I choose which one I go to see?
Well, as we like to say during the period we were stumping for this, the typical psychiatrist doesn't have a PhD in psychology. So we have the broad training in psychology that we come and add on the medical training that allows us to do this safely and effectively. And we think that's the right mixture, that it's really not necessary to spend 4 years studying bones and things like that and then learn about the mind. So we spend the first formative years learning about the mind and then learn how to address the chemistry of the mind.
And Dr. Centel is a diplomat. I sometimes say, well, I've never had to professionally probe a body orifice, so, but that's probably a little cynical.
So just for clarification, when a person decides, hey, I think they've got their medical degree or they're close to it, and they decide, I think I want to do psychiatry. Mm-hmm. You're saying that there maybe hasn't been much study so far in psychology?
I don't want to disrespect any psychiatrists at all, but at Vanderbilt, when we all were in the call box together,
right, and you worked with people who were getting their medical degree and specialty psychiatry.
The early resident was really way behind in terms of knowing about the mind and psychological theories and things like that. So they had a lot of catching up to do. Mm. And of course, again, like I said before, we are statistically oriented. We want to know, how many standard deviations away from normal a person is, and that justifies a lot of the interventions we want to do. People
right.
say you're putting all these kids on Ritalin, not unless they are too standard. If in terms of intellectual functioning, we say a person's intellectually disabled when they are below 70 in IQ.
Right.
So in the same way, if you're below 70 in your attention quotient, we can call it, then probably you're going to need a bit of a stimulant medication, probably to get you to be functioning at your maximum capacity so that you can realize your potential.
Well, let's talk about that a bit because, again, I hear, and I know you guys are aware, you hear, I don't want to put my child on drugs. I don't want to start my child on drugs.
Right.
How safe? When we're talking about prescription medication like Ritalin, like Adderall, like Focalin, many other choices that are available to you, both stimulant and non-stimulant. How safe are those medications?
One of the things that I tell my patients is I never like to use the term safe and medicine in the same sentence because, aspirin, Tylenol, even vitamin C can be dangerous if in the right circumstances. Right. On the other hand, the active ingredient in some of these medicines, Ritalin and Adderall, some of the earliest medicines we knew about. Psychiatric medicines didn't really come on the scene till the late 1950s, with the exception of the stimulants which they used in the 1930s.
Wow, they've been around that long.
The Japanese, the German Army, and the United States Army all used their variation of those during World War II. The first psychiatric medicine for children that was ever written in a journal was the active ingredient in Adderall.
Wow.
1939, I think.
Wow.
I do think that our society is too pill oriented. Let's find a pill and fix it.
Right.
But I also think that the other side of that is we're too afraid, and probably in reaction to that, too afraid to use medications, and which is why I'm really comfortable with the balance that we were talking about earlier.
Yes.
Sometimes it's appropriate. I don't think medicine is usually appropriate alone, personally, and there are times when non-medication interventions are insufficient alone. They should complement each other if they're used together.
Yes. I tell you, folks, you don't want to take a chance with your child's brain, with your child's ability. These gentlemen, I would trust my children and grandchildren to Dr. McCormick and Dr. Sintel, and I would listen to what they have to say. They are balanced, and they will not rush to judgment, if you will. Now, Webb, I know you have a bit of a reputation for also being open to the alternative meds. I know you and I were discussing not too long ago some research that you had found out of Japan on pharmaceutical grade fish oil.
Right. We are now realizing that omega-3 fatty acid has a lot of uses. It helps stabilize mood, and it helps the frontal lobe. And there's some research that when you combine omega-3 with gamma-linolenic, GLA, which is commonly found as evening primrose oil, and a combination of a 4-to-1 ratio, that's helpful for some kids. Now, I don't find it to be as anywhere near as effective for a hyperactive kid as the regular stimulants, but people that want to try that, that has a certain amount of research support out there, and it's certainly good for mood as well, and it has antioxidant properties. That's something that's even good for your older patients.
Dr. Bruce, on the same page, you touched on this earlier, and I think it's important. You know, there are some of us that say, well, if I go and I can get it from the health food store, I'm okay, and I can just take a gazillion of these, and I'll be more okay. What would you tell me?
Well, certainly, the pharmaceutical companies do not have a monopoly on things that can be helpful. But just because it comes from a health food store, it's so-called natural. Is no guarantee that it will help, and certainly no guarantee that it's safe. I mean, the classic comeback is, well, hemlock is natural.
Yeah.
Oleander is natural, but it'll kill you really quickly.
Yeah. You got to know what you're doing. So buyer beware.
And the problem is, these are not regulated by any national or internationally recognized agency. So, talking to pharmacists and pharmacologists, toxicologists, are a wealth of information for those types of things.
So again, to all of us, a reminder to do our due diligence. But again, what if we have an issue, if I'm young, or have a child or a grandchild, if I'm a young man like Webb and I and Bruce. Or I'm approaching my elder years like Reuben over there. I would be, I could come and I could sit down and talk with you gentlemen, and talk to you about what's going on with me, body and mind.
Absolutely, and I welcome people to do their own research. I learn from my patients all the time.
Yes. How would we contact your office, Dr. McCormick? What's the best way that people could get in touch with you?
Oh, we're in the phone book, Dr. McCormick and Associates, Family Psychology. It's a local number, 865-7500.
All right. Dr. Sintel?
We're on out on Line Avenue, out by the Crosser Spring Lake, and we're at 318-868-2001.
All right. Dr. Bruce McCormick, Dr. Webb Sintel, we are learning about medical psychology today here on Strategies for Living, breaking new ground. Hopefully it won't be the only time you guys come. You've got to come back.
We'd like that.
Yeah. We will be back to put a wrap on Strategies for Living today. Maybe we can get Carla to talk.
I know, I'm dumbfounded.
We'll be back. What you doing, man?
I thought you'd like that.
I do. Welcome back. Welcome back. It's a private joke, folks. Welcome back into 101.7 FM and 710 KEEL. Welcome back into Strategies for Living, Marriage and Family Therapist David McMillan, PLPC Carla McCormick, and Dr. Bruce McCormick, and Dr. Webb Sintel, medical psychologist, actually MPAPs, Medical Psychologist Advanced Practice.
It's a lot of letters.
Yeah, there's a lot of letters there. HIJKLMNOP. So let's kind of, we've got a couple of minutes here. What have we left out that needs to be said, Dr. Bruce? Have we left anything unplowed today?
Well, we've had a good chance to talk about medical psychology, how it came about in Louisiana, and what we have to offer, and of course that's something that we're very happy with and very proud of. But I think it's important to again emphasize what you said before. Medical psychology has a place. It's not the only profession that can be helpful, and sometimes the connection between individuals, between the professional and the person that wants to get to know a professional, can be as important as anything else. And,
yes,
and that's something I would certainly want to acknowledge.
Absolutely, the relationship. Anything that we've left out as far as you're concerned, Webb?
David, when I was at Barksdale, I could treat military service members. I can't treat them at the VA. I would encourage all our listeners to get busy, call your Congress people, and tell them, let's get medical psychology in every VA hospital across the country. There are people that need to be served. There's not enough psychiatrists.
Absolutely, and again, it's just a matter of legislation. Call your senators, call your representatives.
And well, I couldn't agree more. But I think it's also important to realize that that's actually a cost savings to the taxpayer as well as a benefit to the veterans. We have people there that are licensed to do this already. They're already on the payroll.
Wow.
They're just not being used.
They're just not being utilized.
There's about 4 in Alexandria, I think, that
Wow.
can prescribe it, but not credentialed to do it.
Gentlemen, thank you so much. I know both of you are extremely busy. Dr. Bruce McCormick, Dr. Webb Sintel, thank you for coming and being wonderful life strategist here this evening on Strategies for Living. You got to come back. We'll do this again.
Well, it was a kick. Thank you for having us in. Oh.
Absolutely. We'll invite you back again and again. You gonna talk now?
Thank you, guys. I am in awe. I'm sitting here thinking, God, I wish I'd have known back then what I know now, what I wanted to do.
You might have been dangerous.
Well, you know, I'm thinking, how can I go back to school and get this degree? You know, I think that ship's already sailed, but it's quite impressive what you guys are doing.
Thank you, Carla.
Folks, thank you for tuning in to Strategies for Living. We've been presented by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana. Been presented by Milestones Counseling Center, by Jerry Anderson, State Farm Insurance, by Learning RX, by Highland Place, Rehab and Nursing Center, and by Jacob's Well, Inspirational Books and Gifts, and by Resilient House. If today were the last day of your life, you only had one more phone call you could make, who would you call? What would you say? And why are you waiting? Make the call for Dr. Bruce McCormick, for Dr. Webb Sintel, for Carla McCormick, and for Reuben Wright, marriage and family therapist David McMillan. We'll see you next time here on Strategies for Living.
Breaking news and trending talk. This is 101.7 FM and 710 KEEL. KEEL, Shreveport. FM and 710 KEEL. KEEL, Shreveport.
Tensions on the Hill. I'm Lisa Lacera, Fox News. Hours of testimony today from an FBI agent whose anti-Trump texts were uncovered during the Russia investigation, calling into question his impartiality.
Peter Strzok was a lead on the FBI investigations into Hillary Clinton's use of a private email server and possible ties between Russia and the Trump campaign. His text messages to his girlfriend, FBI attorney Lisa Page, revealed disdain for then-candidate Trump, including one text that said they would stop him from becoming president. Republicans like Congressman Matt Gaetz angrily questioned Strzok.
You've said repeatedly today that you were not biased, but Bob Mueller kicked you off his team as a consequence of your bias, didn't he? Sir, I wouldn't agree with that characterization. My understanding was that, and again, there were no words spoken about this, but it was the potential appearance that he wanted to avoid.
The Justice Department Inspector General's report concluded last month that the bias didn't appear to impact the investigation.
Fox's Jessica Rosenthal. Lisa Page is expected to appear before House members tomorrow in a closed-door session. President Trump now